Dear colleagues and guests, good afternoon, everyone. I hope you're not too tired at the end of this fruitful meeting. Thank you for your presentation for me. As you said, I'm working as a microbiologist in the Institute of Public Health, the host of this event. And again, I'm very happy that you have so nice and fruitful conference. Today, I would like to talk with you about bloodstream infections at newborns in the intensive care unit in the Republic of Macedonia. According to the literature, most frequent hospital-acquired infections in neonatal intensive care units are respiratory and bloodstream infections. Usually, hospital-acquired infections are because of extended periods of hospitalization, which means from several days to 1 or 2 months at premature babies. Then the large number of invasive procedures that are made to this population, lack of personnel, and crowded wards. The situation in the Republic of Macedonia is not much different than other developing countries. In Macedonia, there is one public neonatal intensive care unit and is situated at Gynecology and Obstetrics Clinic in Skopje. There are 52 beds, 8 pediatricians and 21 nurses in this ward. And in 2013, there were around 600 patients, and in 2014, 665 patients in this ward. The aim of this study was to analyze the most frequent bacterial isolates from blood cultures at newborns hospitalized in this ward and their most common resistances to the antimicrobials. This was a retrospective study which lasted 2 years from the beginning of 2013 until the end of 2014. As a sample, we used 1 to 2 milliliters of blood from all newborns in the unit taken in the first 84 to 72 hours after hospitalization and after if needed. Against all the rules of good sampling, we took only 1 blood sample from 1 patient. The incubation was done with the automated system, BACT alert, and then positive hemocultures were proceeded with standard microbiological methods. We used disk diffusion tests for susceptibility and also automated systems like Vitek2. From a total of 1,745 blood cultures, positive were 5.1%. 56.2% of these positive cultures were positive with gram-positive bacteria. 72% of them were coagulase-negative staphylococci, and out of them, 70% were methicillin-resistant. It was no evidence of resistance to vancomycin and linezolid. Here you can see the distribution of gram-positive isolates. 43.8% of the positive hemocultures were with gram-negative bacteria, and most of them, 53.8%, were with Klebsiella pneumoniae. Then were E. coli and Burkholderia cepacia. Here you can see the distribution of gram-negative isolates. 90.5% of Klebsiella pneumoniae species were producers of ESBL enzymes, which means that these species were resistant to the 3rd generation cephalosporins. Yeah, a very big percentage, and 42.8% of E. coli species were ESBL positive. The good thing is that we still don't have invasive isolates of E. coli and Klebsiella pneumoniae resistant to carbapenems. Here I made a comparison of positive chemocultures in these both years. So we can see that in 2013, where is this? Here, the most number of the positive bacteria were coagulase negative staphylococci, and in 2014 is Klebsiella pneumoniae. So the bacteria merged from gram-positive in 2013 to gram-negative in 2014. Burkholderia cepacia is gone from the list in 2014, here, 0. From all of this, we can conclude that gram-negative bacteria, especially Klebsiella pneumoniae, are a significant problem at neonatal intensive care unit in the clinic, at the Clinic for Gynecology and Obstetrics in Skopje. Also, we can say that it's difficult to determine coagulase negative staphylococci infections because of one blood because it's obtained one blood sample. As public health experts, we can recommend to the management of these wards to ensure that intensive care units are less crowded, to increase staffing levels and the healthcare personnel to be better trained, to implement antimicrobial stewardship and surveillance, and also to implement surveillance programs for hospital-acquired infections and antimicrobial resistance. Here I would like to thank to all personnel from the Department for Bacteriology and Antimicrobial Resistance in the Institute for Public Health, where I work, and also to the personnel at the University Clinic for Gynecology and Obstetrics, Mother Teresa in Skopje, the Neonatal Intensive Care Unit. Thank you for your attention.
Thank you, Biljana. And now the floor is for question. Yes?
Thank you for your comprehensive presentation. I'd like to ask about if this these cultures done as a routine for all admissions?
Yes, a routine work, yes.
For whole of admissions?
Whole admissions?
Of a newborn? If it is done for the whole, so we are not in need to find the other admissions, because you decided that you go back to find results of cultures of about
1,074,
yeah.
1,745 hemocultures, and it's regularly, yes.
They are the total admissions, or there are more admissions rather than this number? There are more admissions?
No.
Another newborn not included in your study? Because I ask about if there is another admissions in the same time of the study, we have to include to know you have numerator, you need denominator to study. For example, you are in the year 14, year 15.
Yes,
in the year 14, I don't know about number of admissions to compare 14 to 15, except if this culture is done as a routine. If the culture is done as a routine, it's okay.
Yes, it's a routine.
Okay.
Yes, it's a routine.
Okay.
Thank you for a nice presentation. Is the complete for my question? If you have presented the result between the time to difference, this is the majority of result is period of this result if the older period. My question is, do you have the possibility in your study to present the result positive or negative in the all 2 years? If you have positive 1 week, number 1, how many positive? 2, how many positive? In order to have idea of the different situation of 2 years.
Mm-hmm. I know. As I said, and our colleagues said, I work as a microbiologist, so I'm not very much in the epidemiology field. So I have to hear colleagues in the epidemiology field, so if they can help. But I work as a microbiologist, so it was my intent with this presentation to show you that this ward has a really problem with the gram-negative bacteria and with their high resistance to antibiotics, which is a real problem with the therapy and everything. Also, as dear Carmen said, this week we celebrate the whole week of antibiotic awareness, World Antibiotic Awareness Week, and we had a lot of we organized a meeting in the Monday. We also are in the CSER network. I hope you know about CSER. It's a pendant to EARSnet for the countries that are not in the European Union, about the surveillance of antimicrobial resistance. And we had this week, we also will have organizing lecturers to 5 schools to the children and 5 clinics also that submit the biggest number of the hemocultures in our country.
Well, I have a question actually in relation to this. Is your study part of the context of this surveillance system?
Yes, it is. It is, because these results are going in the same network. But here it's only gynecology and obstetrics, the neonatal intensive care unit, and in the whole survey, it's every clinic that submit the hemocultures in every laboratory. So all country is involved. All microbiology laboratories are involved.
Yes, please.
Really quite alarming results, the high level of ESBL producers, and
Yes.
experience in other countries is that ESBL spreads very rapidly.
Yes.
So it would be interesting to know whether those babies that had ESBL infection, had they been on the intensive care unit for a long time,
Yeah.
or did they come in with it, indicating that it's a generalized problem in the community?
So thank you for the question. These babies are from the start in the intensive care unit because usually they are premature babies or with some signs of infection, I guess, that they are so from the beginning, first beginning of the born, they are at the intensive care unit. They are not. And the protocol of this pediatric ward there is to take hemoculture from the very first beginning, from the very first start in this ward.
So that being the case, it suggested, as you say, that infection control practice really needs to be strengthened in that unit. Yeah.
Yes, yes. Yeah, especially with the devices that are applicated to the babies and hands to the workers.
Okay, thank you very much.